Very. This is a very nice initiative, Dr. Madhukar Reddy. Amazing talk, Dr. Ravindran. It was an eye opener for me. I mean, really, the first slide which you just showed about 500 kilometer, that was like, I couldn't believe it myself. Like, is it? I was thinking in my mind, is it the motors that we use in the emulsification? Is that? But it's actually the waste supplies, and this is something to really look into. That. But what I am going to touch base is a way by which you can actually go green by avoiding too much of transportation or mobility of patients due to appointment systems, and how the newer technology can help us in doing things from wherever the patients are and still giving a very good clinical outcome. So it's all related to telemedicine, but a little bit more advanced, like what else we are doing in that region. So I will not go into the depth of what we are doing in Center for Innovation and Technology, but the whole idea is everything is now digitized, and there is a huge potential in actually utilizing the softwares and tuning them for patient centric experience using AI. So most of the, even if you see the trade stalls and wherever the AI is being used, it's all directed towards clinicians and the technicians. So that's where we are looking into how we can make it useful for the patients directly in the hands of the patients. So we can save physical visits and travel, avoid routine follow-ups, convert them to teleconsultations accentuated with videos, images, and also power them with AI, wherein you are also saving clinicians time over there. And have robust appointment system, make newer slots for newer patients. So what we were thinking AI would do, and when we talk about primary eye care, the image of AI changes. You need assistive software modules on a scalable platform. You need a very simple device which can be translated in multiple vision centers, but that has to run on AI. So it's not a very advanced tech, but it is advanced software with simplest of hardware that will reach to the community. So one of this was our smartphone device. I'll tell you why I'm showing this, because when we started this, we were thinking of making something really nice for the doctors, which will have a lens and light source, and but then we realized that the real potential is what if the patients use it. And we found out that the more complexity we put into the device that we make, the patients find it useless. I mean, for example, what is the use of a slit for a patient? If you're having a slit beam in your smartphone image capturing device, it's of no use to the patient, doesn't know how to use the slit. So we just removed the whole thing. We made it very simple. We just kept it as simple as that plastic hardware that sits on any smartphone, and we tuned our app in such a way that it clears off the problems of magnification, illumination, and focus. So all that patient had to do was go into the app, just tap on the screen, and their photo gets uploaded on the cloud, and the doctor is able to see from the center. So not even the need to go to a vision center. Directly it sits in the hands of patient at their home with their own smartphone, which they know very well how to use. All we did that, we just trained their relatives after post-op. That's it. Those 10 minutes we invested in them, and just look at all those images are captured by patients and their relatives. These are post DSEC, that is an infection post TABCL patient, and the outcomes are very good, very simple, very useful technology. And all we tell them is, just bring your black part within that white circle and just tap on the center of screen, job is done. So this is an image of the patient sent this without using our app and device, and then I asked them, please use both and just see the difference. So I could actually give them medications based on this particular image, and you can see there is one loose suture also there in the last image. So similarly, one more patient like this one. So this guy, during the COVID time, we had to do an emergency transplant for him. He was one-eyed, and he couldn't follow up. So we trained his son on this device, and almost for 10 visits, 4 months, we could manage him successfully with this, until he developed an epi defect, when then I could identify it on this and we sent him down. Again, these are sent by the patient. This patient is taking selfies, looking in the mirror and tapping and sending these images, such beautiful images. Now why would you want to call him when he's sending you an image like this? And opposite to that, that one patient called me and said, I am having a white dot, and I was like, okay, send me a photograph. And we knew that this is a patient who actually needs to come, and you don't need to call the other. So you can actually filter through and screen. You don't need to call everyone at 1 week or 1 month. You can screen through. You can now actually triage the whole system. And this is what we did, our Connect Care, the teleconsultation app. So the we calculated in overall that what was the environmental impact, especially during that time of COVID, that we generated. And what we found out was that we could save the travel cost of patient, which was up to 5,000 rupees per patient, which is close to 1 million US dollars. And that also led to an environmental impact, as you can see in the last slide. That's up to 11 lakh of kg of CO2 emission. 1.1 million kgs of emission was saved just during that COVID phase, just because we converted most of these into teleconsults. So this is the team that has worked really hard behind in developing this grabby product. Now how do you make this better? So there are a lot of works going on in different institutes and groups, especially in China. And also I from Arvind, they have come up with an amazing AI algorithm for diagnosis of microbial keratitis lesions. We are also working on the same lines, and we believe that application of these is going to change the way we follow up the patients and see them even before they come to the clinic. And I'll tell you why. So this was one study which was they did in China, and if you see, they're trying to identify cataracts, no, OSSNs, infectious corneal diseases, the corneal degenerative changes, dystrophies, and normal eyes. So they are generating a data set by which it can actually identify the lesions that you want to see. This is something that we were working on, where we are using some latest patch based CNN to identify what is the white spot in the cornea and whether it actually needs a referral or not, whether it's a scar or whether it's an active infection. And it works pretty well if you actually train the algorithms very fast. So what I feel is that you need to train a new workforce which understands this. And it's no longer just medical and engineering community. You need to train them together into deep learning, AI, and also have combined mentors in hospitals and third party collaborators, where you can actually implement these solutions at your tertiary centers, secondary centers, as well as your vision centers. There are many online courses also, I researched about them. So if, again, these things you can educate it right from your apex center, and you don't need to have a separate course for this. This is a very easily translatable technology. Another example what we are working with is post keratoplasty aftercare and AI chatbot. And this one is operating in multiple languages. It is able to identify all the symptoms of the patients, whether there is a drop in vision, whether there is redness, whether there is pain. And in that also, it just asks for your MR number, or it asks for your pin code, and then it will give you a geological location, which is the nearest LVPI center that you can visit quickly. And it has a facility again where it identifies the image, sees it if it is really a hypercritical situation or not. So we are training this bot so that even if the patients are in an emergency and they cannot reach to the centers, cannot reach to the phone lines or anything, they can actually access this, and they can get a good advice. To that extent, there are some amazing algorithms which exist right now that can identify whether in a given image an eye is present or not, and eye is in good focus or not. So it just removes the need of a trainer also. So all the patients have to do is just take an image and everything will be done by itself. So that's where we are heading into, and we are actually trying to build a lot of things in that regard. Because time is up, I will wrap up. I just wanted to stress some base on this. Thanks. Yes. Yes. Yes, so it will be used, these APIs will be used in that chatbot. So it will try to analyze, it's all how we train it to do. If their training will be to identify the most emergency hypercritical cases which needs consult. What we are trying to do is avoid consultations for minor issues, wherein the patient is having itching or redness, but actually it's not a surgical indication. You can still manage them with medications. So if you are able to identify that with a simple picture which the patient is able to take from their home, you're saving so many costs for the hospital and as well as for the patient. Same as what we have the current teleconsult policy. So it can be used as an offline teleconsult business module also. I mean, we have not explored that as of now yet, but it is a potential space where you can actually go. It's like how Swiggy and Zomato have those chatbots. It's very similar to that. Yes. Yes.